about Mpox, and I'm seeing your questions coming in. Keep them coming on 0700917917. Let's talk about it. Let's get to understand what Mpox is, what causes it. I'm here with Caroline Agutu, County Health Promotion Officer, Mombasa County, and she's just giving us bits and pieces of what you need to do about Mpox.
Yeah. So most of the time, there are some, let me call them assumptions that people assume that if we have a certain disease, probably some people are at risk and others maybe are just safe. Mm-hmm. So in this case, when we talk of the Mpox, who exactly is at risk?
Yeah, so when you're talking about Mpox disease, I'll basically say that everyone is at risk. Mm-hmm. But of course, there are those who are more at risk as compared to others. Okay. But basically, everyone is at risk. But those who are more at risk, the risk degree varies. So we have the healthcare workers. So these are those people who are usually in contact with now the infected individuals. Because they have to take care of them. They have to carry out several different investigations. Yeah. So if not done well, then definitely it means that they become more at risk. Okay. Yes. Then, of course, we have the caregivers. Here I have a sick person. Yeah. I am the person taking care of this particular sick individual. So if I also don't put infection prevention control measures in place, then it means that I also become very much at risk. Then within the community, we have those people who definitely are immunosuppressed. Their immunity is not as good. There are those who have comorbidities. So, and if you have any other diseases, then it means that we have non-communicable diseases. Yeah. That definitely brings down the immunity of individuals. Yeah. So it lowers the immunity of individuals. So those people are also more at risk. And these are people who maybe have diseases like hypertension, diabetes, HIV and AIDS. Then we also have pregnant mothers. And research has definitely shown that when you're pregnant, your immunity tends to be lowered. Okay. Yes, so they are also very much at risk. So apart from those the ones I've mentioned, we also have, I can say, there are groups of people who are sexually active. Yeah. So these particular individuals also become more at risk. Yes. And of course, there are those who have traveled from the areas in which the disease is. We have outbreak of this particular Mpox disease. So they also become more at risk because they are from those areas. Okay. Yeah. So those are the individuals who are more at risk.
So does it mean that there are some regions that are at high risk too?
Yes. Like right now we have outbreaks in West Africa. Yeah. So definitely, if you're an individual from such a place, you see, for us, we are on high alert. So such people in those areas are more at risk of contracting the infection, contracting the disease. All right. Yeah, because the environment is not conducive. Oh, right. They have the outbreak. Yeah. So if you're not so careful, what happens? You become infected. Yeah.
Okay. So I noticed the symptoms. Okay. I noticed the rashes that turn into lesions. What do I do next?
Yes. So if you see, this is one thing that will not just take like a day. It takes a number of days. But there are those symptoms that just appear. Okay. And as I said, different individuals present differently. Yeah. So if you see one or two of the symptoms that we've talked about that are associated to Mpox, the best thing to do is just to rush to a health facility. And as it is for us as Mombasa County, all our health facilities are on high alert. Okay. They've been sensitized. And so once you reach there, definitely you'll be taken through screening. And if there's need for any tests to be done, they'll definitely do it. Okay. Yeah. So since you have any of the symptoms, the best thing to do is just to go to any of our health facilities within the county. All right. Yeah.
And
you definitely get help.
There are no rooms for assumptions, because I know most of the people out here you just feel a bit like a fever, and you rush to the chemist and
Yeah, we would really discourage the thing of self-medication. So if you're not feeling well, you have those symptoms, just rush to the hospital. And I believe it will not cost you much. It will not cost you anything. Even if you go, there are several tests that will be. You will get the healthcare workers there to take care of you, questions. And if it is not Mpox, then definitely you're having fever, maybe chills, or even that headache, or even that backache, might be any other disease. So if you go, you'll definitely get help. Investigations will be done. They'll come up with a diagnosis. So it doesn't have to be Mpox, but whichever disease you'll be suffering from, you'll definitely get treatment.
All right. Somebody's asking, is there a cure for Mpox? Ama ni historia kubahatisha vaccines tena?
Okay, now treatment for Mpox. It's a virus. It's a disease that is caused by a virus. And we know very well that in most cases, viral diseases, they tend to just stay and then wear off.
Okay.
But usually, I'll still say that it depends also with individuals' immunity and with different individuals. So there are those who will just experience the signs and symptoms, and they will not get to a stage whereby they're severely sick.
Yes.
But there are those who will definitely get other infections along the way. So what they'll do, they will treat those infections that have come up. Let me call them secondary infections as a result of the Mpox disease. So depending on whichever condition you get while having the Mpox disease, the doctors will take care of you and they will know exactly what to give you.
Okay.
Yeah.
So it's a vaccine situation?
There is a vaccine for it.
Okay.
Yes. And I believe when it gets out of hand, and we are praying that we don't get to such a state, then for us as a county, what we need to do is basically consider the prevention measures in place just to ensure that we don't come down with the transmission of the disease.
All right. I'm here with Caroline Agutu. We're talking about Mpox. What question do you have? 0700917917.
Nobody do it like we do it, so show us.